Hello, my name is Yusame and I will be demonstrating how to take someone's blood pressure. But first, a little information on the subject. What is blood pressure? Blood pressure is the force per unit area exerted onto a vessel wall by the contained blood. The normal values of blood pressure are 120/80, which is systolic over diastolic. Systolic is when the heart contracts, and diastolic is when the heart relaxes and blood is flowing back into the heart. Here are the instruments we use to measure blood pressure. We have the stethoscope, which contain ear tips, and always make sure these are facing forward when placing them into your ears. At the end of the stethoscope, we also have a diaphragm. Always make sure that it's working properly just by tapping the diaphragm lightly. Here we have the blood pressure cuff, which we use to wrap around the patient's arm. It also contains the pressure pump and the pressure gauge. On the pump, when you turn it to the right, this will close a valve which will not allow air to escape the cuff. When you turn it to the left, this will allow air to escape the cuff. Then we have the pressure gauge. This will help us measure the systolic and diastolic pressure. This is Katerina and she will be my patient. So we will place the blood pressure cuff around her arm. And then we will put on our stethoscopes. And always make sure that the ear tips are facing away from you. Make sure the diaphragm is on and place it underneath the cuff right where her brachial artery is. And you may place the gauge right on the cuff where you can see it. Then you will take your pump and turn it all the way to the right so no air escapes the cuff. Then you will keep pumping until you reach somewhere between 160 or 200. And you will slowly release by turning it to the left. And you will listen to the first thump. And then you listen to the last thump. It is very important to regulate blood pressure to prevent hypotension and hypertension. Chronic hypertension is the leading cause of cardiovascular disease and can cause micro tears in the blood vessels. Chronic hypotension will lead to necrosis due to the lack of blood flow to the periphery. Here are just a few tips on how to maintain normal blood pressure. You must exercise regularly,